Okay, just waiting for a few more people to log in, but I'd like to just introduce today's webinar. So those of you who have not tuned in before, I typically do 2 webinars a month, obviously on photobiomodulation or light therapy. There's probably 100 different names for what we do, and I'm sure you're aware of a few of them. My name is Dr. David Kunashko. I'm the medical director here at BIOFLEX Laser Therapy. And today's webinar is geared towards the BIOFLEX Personal Therapy System. I'm doing a similar one, but a little bit more in depth and using our professional equipment, including class 3 lasers in a couple of weeks as well. So if you can let me know in the chat box your name, where you're from, if you actually do have the BIOFLEX system, or maybe you're just interested in learning a little bit more. I'd always appreciate information. It's great for me to understand that. I always get emails about whether or not the webinar is recorded. So if you're paying attention, they are recorded. They're edited, then uploaded to our website. That usually happens within a week. There's some variables there because only one person does it, and sometimes that person is not available, or it can't be done quickly. So we also send out a follow-up email. As long as you've registered for the webinar, you don't even have to show up. You'll get a follow-up email that will have a link to watch it again. So just for future reference, you can always watch it again at some point in the future. So the reason why I want to do one on sports injuries, kind of a generic one, is obviously the weather's getting a little bit nicer. People are starting to be a little more active. And oftentimes that's when you start to see an increase in sports injuries. And many of them, people don't seek treatment, they just deal with them at home. Although oftentimes I do recommend that you get checked out. But regardless, using light therapy or photobiomodulation therapy can be very helpful, especially when an injury just happens. And that's kind of what I'm going to be focusing on today. Give you a little bit more information about that, some of the current research that may help you prevent these injuries as well, what you can do to warm up or train to prevent them, and also how you would use the personal therapy system for treatment of these, again, sort of acute sports injuries. I can't do anything in depth today, given it's such a large topic, but I want to give you the general idea of how to approach that. So I'll talk a little bit about our systems and what photobiomodulation or red light therapy, as you may have heard that term, or cold laser therapy, or low-level laser, low-level light therapy, lots of different terminology. I'll talk about what this is, and then I'll get into some of the more common sports injuries and how they're typically managed without light therapy, and then specifically how you would use BIOFLEX for these types of sporting injuries. And then we'll have time for Q&A at the end of today's session. So if you have any questions, type them into the Q&A box. I'd really appreciate that. That's the box that I look at for questions. So if you're typing in questions in the chat, I usually miss them because I apparently can't multitask. So I just look at the Q&A. So again, I say again because I've done many of these, and many of you have our system or are familiar with it. But for those of you who are not, we manufacture and build everything here in Toronto, Ontario, Canada. Everything is made and designed and engineered here. And we sell 2 types of light therapy systems, what's called a P120 and a P180. And they come with a controller unit and 2 different sizes of light pads or light arrays, different names for them. These arrays of light are very unique. And I say that because there's nothing else like that on the market. You can look, you won't find anything. And that's because each of the diodes are bi-color. The LEDs that we embed in the silicone emit 2 wavelengths. Not at the same time. They emit first red at 660 nanometers and then near infrared. Similar manufacturers might embed a red and then an infrared and kind of go back and forth. The issue with that is LEDs don't have a lot of power. And so you want the energy to be very dense. In other words, you want a lot of energy density to enter the tissues to be effective. And if you compact the LEDs very close and stack them close together and then emit the light, then you have a more effective form of treatment. So when they're spread out, you have less energy going into the tissue. If they're compacted together, which we can do when you combine bicolor diodes, then you get better dosaging. We also have the what looks like little sort of raised bulbs. These are magnifiers that make contact with the skin in order to drive the light into the tissues. A big misnomer about light therapy is that you can just stand in front of a red light panel or hold light off your tissue and have the same effect. Now, I'm not saying LED panels have no value. They actually do to some degree. More of a wellness type of scenario where the red light is helping sort of in a systemic way, but not in a direct dosaging way that you would use light therapy to help heal a condition. And that's what we're focusing on here, and not a wellness product. This is a medical device designed to help with treatment of assorted injuries. So initially, when you turn the system on, red light comes out. Red light is known to penetrate relatively superficial because in the bandwidth, you also have absorption by hemoglobin, myoglobin, and other photoacceptors, and therefore it's relatively shallow penetration, which you wonder why that would be good. It's good because actually it can treat lots of blood because blood is quite well circulated in the superficial aspects of skin. And also, there's lots of pain and sensory receptors that can be affected with red light as well. So it's good for analgesia, and it's good for helping with treating the blood, which has a sort of systemic effect. The second part of the treatment is near infrared. You can't see this light. The only way you can see it really is to put your camera on your phone, either iPhone or Android should pick it up, and you should see a purplish hue come out. And that's the near infrared at around 830, 840 nanometers is the wavelength that we use. The controller has different settings, or what we call protocols for different anatomical regions. You would choose the appropriate setting. In the case of sports injuries, it kind of makes sense. You're going to choose the setting or the protocol for the area that's injured. So I think that should be pretty straightforward. The controller itself has a power button, so you power it up. Of course, it needs to be plugged into a wall socket. We oftentimes get asked why we don't have, a portable sort of battery-controlled system. The LEDs, the amount of LEDs that we use and the power that it emits is a huge amount. So the problem with that is that you either have a really heavy and bulky controller, or you can only treat for short periods of time. And so for right now, and given that the power we want to emit and the diodes that we use, it's not efficiently possible to do that currently. Now, for smaller pads, that kind of thing, which we may or may not be working on, then we possibly can do that. So stay tuned for future releases. Now, how does photobiomodulation therapy works? Well, we know some stuff. We don't know a lot. And interestingly, I read an article by a science guy at McGill University. And apparently he was asked his comments about using photobiomodulation for brain conditions. And he went off, I believe, on a tirade about why photobiomodulation is all hype and there's zero science to show its effectiveness. And quite honestly, I'm going to respond to this guy. Quite honestly, I was quite upset when you have someone that has a master's degree and doesn't take the time to look at the clinical trials and have an understanding of what they're talking about. And unfortunately, that's what you get a lot in science and in the medical world is they choose to put something down before they actually read what's out there, especially from good journals like The Lancet or Nature or Science or whatever other journals that there's lots of good research out there, not to mention the American College of Physicians and Surgeons recommend laser therapy for back pain. CDC guidelines in the United States recommend laser therapy for pain, acute pain. So, I mean, these are organizations don't just say to use something without clinical research. So that's my little tirade for the day. So anyway, let's move on. So there are direct effects and indirect effects of photobiomodulation. Directly is when the cells are absorbing the light. And there's some things that we know, as I mentioned, some things we don't know. But when light affects and is absorbed by certain photoreceptors, especially in mitochondria, it can help improve metabolism of the cell. Now, the understanding here is not a magic bullet or anything of that nature. When you have inflammation, you tend to have an increase in intracellular nitric oxide that inhibits oxygen from binding to these photoreceptors in certain enzymes that control ATP production. So when they're depressed, the cells don't function very well. And this is a problem in inflammation and healing. The goal with therapy is to improve and resolve inflammation. The problem with inflammation is that it can be long-lasting and it can be improperly treated and or controlled. So what light therapy does, it actually helps to accelerate the inflammatory process and move it along by disassociating nitric oxide where it binds and allowing oxygen to binding back on. That's one more than likely mechanism at play. However, there's many others, including the release of nitric oxide that's been measured in research trials. And that, of course, causes vasodilation. There's other effects of nitric oxide in the cell and that are positive with respect to helping these cells repair and respond to injury. And that's essentially how it's working. But there's lots of other things, including ion channels at play, a sodium-potassium pump, calcium ion channels. We still have a lot to learn, no doubt. There's also something that's been researched, and that's indirect effects of photobiomodulation therapy, where circulating white blood cells and stem cells absorb light, and it seems to have a anti-inflammatory effect. In other words, these white blood cells, when they are exposed to these wavelengths of light, they release more anti-inflammatory mediators. White blood cells can release pro or anti-inflammatory mediators. Pro-inflammation, of course, causes inflammation, which is good, but then you want it to resolve. And so what happens is they eventually shift towards anti-inflammatory mediators, but it's not an easy process. Oftentimes it's stalled or delayed, prolonged, and hence why light therapy might be helpful, and hence why other types of therapies are done as well. By the way, this genius at McGill didn't mention the McGill study that talked about why NSAIDs should not be used for acute pain because it increases the risk of chronic pain twofold. And that was a study right out of McGill. So yeah, let's read the research. So 1.35 million children visit emergency departments for sports-related injuries each year in the United States. That's a little quote. Most of these stats come from the States. So you just divide that by 10 probably to get for Canada. So a lot of the kids, adolescents, and of course, even more adults are probably going up to emerge and or at home with sports injuries. So it's a big statistic, and these things happen all the time. This is pretty recent information, by the way. The term sports injury obviously refers to injuries that are most commonly occur with specific exercise, obviously not limited to athletes. And there's two types of categorizations of injuries. There's acute, which is kind of what I'm going to focus on today, which obviously happens suddenly. You twist or you turn or you do something, you get injured. And of course, chronic injuries that usually are due to repetitive overuse. Think of those as things like shin splints, chronic tennis elbow, those kinds of things where, gradually you go, oh, my elbow's starting to hurt, as opposed to like, oh, I can't, walk on my ankle because I sprained my ankle. So I'm going to talk a little bit more about acute stuff today, as opposed to the chronic injuries. Now, in some cases, wear and tear from overuse injuries can set the stage for acute injuries. In other words, if you have lingering injuries, oftentimes you have weaker structures around the joint. You tend to be a little bit more susceptible to having a follow-up actual acute injury, which is why you shouldn't be playing a sport, doing athletic activity, unless you're feeling close to 100%, because you set yourself up for having a much worse injury. So there's quite a few risk factors for sports injuries, including not using correct exercise techniques, especially for weightlifting, those kinds of things. But that even goes for things like running, playing, golf, playing tennis, squash. If you don't know the correct technique, then you tend to develop or at risk to get injured. Overtraining, either by training too often, too frequently, or for too long. And so that's where you need to understand that there's a finite sort of amount of training one should do before they actually put their body at risk for injury. And that's obviously is dependent on each individual. And also the change of intensity of physical activity too quickly. And that's that kind of weekend warrior thing, or you decide to go, oh, I can run 5K, I'm just going to go out and run a marathon. And then, next thing you know, playing the same sport year round. So in other words, all you do is play, say, squash. That's all you do. And then all of a sudden you go out to do something else and you get injured because your body is used to playing a certain sport or what have you. Running or jumping on hard surfaces where there's less shock absorption is another risk factor. Wearing improper shoes. And everyone should probably get their feet assessed, especially if you feel you're a pronator or a supinator, because that's really important in preventing things like ankle sprains when trail running or those kinds of things. Other factors include not wearing the proper equipment, obviously, having had a prior injury, especially in muscles or ligaments, where there's scar tissue built up and it actually makes the area weaker and more prone to re-injury. Or having certain anatomical features specific to each joint or poor flexibility. So sometimes it's hereditary, sometimes this is just, not having flexibility, and this can lead to different issues. Some medications make you prone to injury. One example would be fluoroquinolones, a class of antibiotic that can actually make ligaments and tendons weaker and can cause them to rupture. So if you're on these medications, make sure you understand these potential side effects and avoid certain types of activities or sports. Otherwise, you might have a serious injury. So the common sports injuries I'm going to talk about today are ligament sprains, tendonitis, not tendinosis, tendonitis, so an acute injury to the tendon, muscle strains, contusions or bruises, which I had a webinar on not too long ago, and DOMS or delayed onset muscle soreness. These are kind of the most common sports injuries that you'll probably experience. So let's talk about ligament sprains. Obviously, ligaments are bands of collagen. They connect two or more bones to a joint that provides stabilization of a joint. A sprain typically is caused by the joint being forced suddenly outside its usual range of motion. And these inelastic collagen fibers are stretched through too great a range, and they actually tear. There's different grades, usually 1, 2, and 3. For today's purposes, I'm talking more along the lines of grade 1 or maybe grade 2. If you have a grade 3 or a rupture, you're looking at a significant rehab. And that's not really what I'm talking about today. Common locations for ligament sprains, obviously the ankle, knee, wrist, elbow, and shoulder. Ankle, especially if you have a history of spraining your ankle, you should be wearing an ankle brace. And same thing goes for your knee. And that would just be a nice preventative measure as well. Now, a severe sprain, regardless of location, should be assessed by a healthcare professional. And this might involve x-rays because sometimes a bad sprain will also be associated with a fracture. And you may not be aware of that. You might just think it's a bad sprain or you can't weight bear, for example, because you think it's just a blown out ligament when in fact there's a fracture. So you do need to be aware of that. Even if it's a hairline fracture, it needs, you're going to take care of that a little bit different than just an ankle sprain. So for example, an ankle sprain, that would be a common most common one. We've probably all had one where you see swelling. Usually it's on the outside, so it's an inversion injury. You'll see pooling of blood and bruising, tenderness and redness initially. Those are the common hallmark signs. If you look at the ligament itself, this is a normal ligament. You can see the collagen fibers are sort of parallel in nature, provide a lot of integrity to the joint, but not a lot of elasticity. So when you turn over an ankle, you actually will tear some of these collagen fibers. So signs and symptoms, as I've already mentioned, include pain and swelling. So the swelling can indicate underlying inflammation within the joint or the soft tissue around the joint. Obviously, there usually is bruising, and oftentimes there's instability. So especially noted on weight-bearing joints like the knee or the ankle. So one has to be really careful about this, because then that just leads you up for more injuries as well. And obviously when there's swelling and pain, you lose the ability to use that joint properly. Now, tendonitis, obviously tendons are connective tissues that connect a muscle to a bone. And again, too much stress on joints, say during different sporting activities, can tear or inflame these tendons. And usually this type of injury is one of those overdoing injuries, especially when sports are initiated for the first time in the season or played only on weekends or occasionally. That's typically where you tend to see these things. You go out, all of a sudden play basketball, and you might get a bit of tendonitis at the knee, or you go out for your first run of the year and you haven't warmed up sufficiently, or your muscles are tight. You can get tendonitis in other areas. So that's usually when you see that. Some other factors that contribute to tendonitis are forceful or violent motions. You tend to see those in things like soccer, for example, or even hockey, sports where you sometimes have to do things very quickly and with a lot of force, or like pitching a baseball, for example. Unnatural movements, like throwing up and hitting a tennis ball, that may lead to some rotator cuff tendonitis. Poor body mechanics or technique when doing these activities. The one that comes to mind is CrossFit. They're usually pretty good at guiding. At CrossFit, I play squash at a CrossFit gym. I don't actually do CrossFit because I'm not insane, but those of you who do enjoy CrossFit, you have to do it pretty carefully, because I've seen quite a few tendons get injured from ruptures to tendonitis, especially from the box jumps, being a little overzealous with it. And depending on your age, tendons do get stiffer and tighter, and they don't have the resilience and the elasticity as, say, when you're in your 20s or 30s. And then you're setting yourself up for these kinds of injuries as well. So tendonitis is little slight tears in the tendon fibers as well. You'll get acute tenderness, some localized swelling, but not hardness of the tendon. And you can kind of isolate where that area is. That's tendonitis. You do the sport, you feel something usually, and then the next day or hours later, you feel the pain. It's quite tender to touch. The next day, it's red and inflamed. That's tendonitis. Tenosynovitis is inflammation of the synovial membrane around the tendon itself. It's a little bit different scenario. That usually comes with repetitive stress. Tendinosis is a degenerative condition of a tendon caused by prolonged micro tearing of tendons, and you actually get thickening of the tendon. A little bit different scenario. Tendonitis is what I would refer to as a sports injury, where you go out and do it and you feel it in a tendon. That's usually what we refer to as tendonitis. It also should heal pretty fast compared to tendinosis or even tenosynovitis. Most common tendons to be injured, I'm sure we're all aware of Achilles tendon, patellar tendon. That's the tendon between your kneecap, patella, and your tibiotubercle of the tibia or the shin bone. Quadriceps tendon, where the quads attach to the top of your patella or your kneecap, in around your elbow. Of course, we refer sometimes to that as like golfer's or tennis elbow. Tennis elbow is on the outside, golfer's elbow is on the inside. Biceps tendonitis is a common one. And of course, rotator cuff tendonitis at the shoulder. Lots of other tendons that can be involved, but these are the typical ones you see injured. Symptoms, again, pain, tenderness, worse with movement. Again, I mentioned swelling and redness. You'll get weakness because of the pain. So one needs to be aware of that and not continue playing the sport or what have you. You need to let the tendon heal. And again, you'll have decreased range of motion, typically because of the pain and the inflammation associated with the tendon injury. Muscle strains, these are tears of individual skeletal muscle fiber cells. Muscle strains are considered to be the most common cause of sports injuries. It's been estimated that 30 to 50% of all sports-related injuries are caused by muscle tearing. So the most common muscles to be injured in sports are the calf, the gastrocnemius typically, although soleus deep to that may also be involved. Hamstring, common injury. The quadricep, 4 distinct muscle groups that form your quad. The adductor, which there's a series of adductor muscles. These are your groin muscles. They help move your thighs inwards. You see that a lot in hockey players. And the back, the erector spinae. How many times have you gone out there to play golf or some other activity, and then you end up with an acute muscle strain related to that? Oh, there's a repeat slide. Whoops. So contusions, bruises. I had a webinar not too long ago, so those of you who joined me in that one, a bruise is due to an injury to soft tissue causing breakage or rupture of capillaries, small little blood vessels, and then that leaks or pools blood into surrounding tissues. That's what a contusion or a bruise is, essentially. Initial signs of a bruise include swelling and edema, along with rapid activation of the inflammatory response of the body. The swelling and pain can limit a joint range of motion near the injury as well. So if you have a bruise, say around your shoulder, your hip, then you might have affected loss of motion of that particular joint. Obviously, these torn blood vessels become bluish discoloration, and the underlying muscle may feel weak and stiff. Lastly, delayed onset muscle soreness, or DOMS. It's a type of ultrastructural muscle injury and is caused by eccentric or unfamiliar forms of exercise. I had an entire webinar on DOMS. So if you're interested more in that, you can go to our website, look under support, and search the webinars for this particular one. It's a combination of high force and reduced recruitment of fibers during eccentric contractions, causing a high mechanical stress that may lead to injury. During sports like running, change of directions, and jumps, eccentric contractions are shorter and part of the entire stretch shortening cycle, also involving, and per time, more concentric contractions. So usually when you're doing sports, you're doing eccentric and concentric movements. So concentric is where you're moving, in this case, a barbell towards your shoulder. That's concentric. Eccentric is when you're under load, lengthening the muscle. Okay, and you actually use different muscle types when you're doing. So that's isometric. Sorry, isometric. My fault. Isometric is where you're just holding a weight. Eccentric is where you're slowly lowering it down, and you're using different sets of skeletal muscle fibers for that, which are more easily injured. And that's why you tend to see eccentric loading exercises if they're overdone. DOMS, delayed onset muscle soreness, can develop under submaximal moderate load conditions, particularly after not familiarized and not well coordinated sporting activities. So again, these are things like, oh, I'm going to go out and try and play volleyball, or I'm going to go out and let me just go to the range. I've never hit a golf ball before. Whatever sport, you just start to take it up, and you may actually develop this type of injury. It's considered a mild type of muscle damage. You also tend to get it a lot with muscle weight training. You'll see that as well. But DOMS, again, you think of it, oh, it's just muscle soreness or whatever, but it can linger for 2-3 days. And it's one of the most common reasons that can compromise athletic performance. So especially in athletes that are serious about their sport, it can really limit their training and their ability to perform their sport. It's associated with impaired muscular force capacities. as I mentioned, soreness, pain, stiffness, and even a bit of swelling. And also can alter the biomechanics of the adjacent joints. So if you have this delayed onset muscle soreness, it can actually lead to further acute injuries if you don't let it heal properly. So all of these injuries essentially are managed with something called POLICE. Now, everyone's heard of RICE before, rest, ice, compression, elevation. POLICE is just another sort of upgrade to the standardized RICE treatment, and it stands for protection, optimal loading, ice, compression, and elevation. So you want to initially protect the area from further damage. You want to load the injured area as you heal to prevent the area from getting weaker. One of the sort of big mistakes that people make is, one, they go back to the sport too soon, or two, they baby it so much and don't do anything that it leads to further problems. So there's a balance there, and that's what this POLICE is about, especially the optimal loading portion of it. So short periods of immobilization is beneficial, but again, depending on the type of injury and the sort of the severity of the injury, it should be limited to just probably a few days after the injury. And then you should start to mobilize. Mobilization is just mean moving the joint or moving the tissue, the muscle, or what have you, as much as you can tolerate without injuring yourself. But without doing that, you'll be setting yourself up for a longer recovery time and improper recovery. And also, as early as possible, weight bearing. This may sound counterintuitive, but it's important, let's say with an ankle sprain, that again, as soon as you can start to weight bear, you start to do a little bit of that. You're not going to injure that ligament more, but what you're doing is you're helping the tissues in the proprioception and the repair process, and including circulation, improve. So BIOFLEX is a form of photobiomodulation. It's going to help improve circulation. It's going to help repair of muscle, reduce inflammation and edema, and help with scar tissue repair. These are the main reasons why the BIOFLEX system is going to be helpful for sports injuries. So again, reference here is acute sports injuries. They really can be treated within a few hours, as short as an hour after the injury itself. If there's bleeding, I wouldn't recommend to throw the BIOFLEX on there because it increases circulation. If there's not bleeding, then you can start to treat it fairly quickly. And of course, you want to do your POLICE type of treatment as a first aid. So the optimal time for treatment, as I mentioned, is pretty quickly, and you want to apply ice and compression as well. Now, I would suggest the optimal time to do laser treatment or light treatment is right after the ice and the compression. The reason for that is that the ice reduces the localized circulation and allows for deeper penetration of the light down into the tissue, so you'll get an even better effect. And this is really important if you're treating a deep underlying, say, a muscle injury or tissues where that light might have a difficult time penetrating. The ice actually allows light to go a little bit deeper. And there's research on that as well, too. So I'd recommend that you treat the injured area, the acute injured area, initially twice a day, morning and evening, that kind of scenario, at least 6, 7, 8 hours apart, especially for the first 2 or 3 days. Then you can start to treat once a day, and typically until the issue is resolved, or you can kind of graduate when it's very mild to maybe every other day, that kind of scenario. As far as time frame goes, well, ligaments and tendons, these tissues heal slower. They don't have direct blood supply into the tissue itself, and hence they take much longer. For mild injuries, a week, 2 weeks kind of thing. For a little bit more serious ones, it can take up to a month to properly heal. Muscle strains, they tend to heal a little bit quicker, lots of blood perfusion, sometimes as quick as a week, but it may take several weeks depending on the severity of the muscle tear itself. So you need to be careful with this, because if you're a runner, for example, or really almost any activity, and it's not quite 100%, and you go out there and do that sport, you're going to probably tear and injure and strain that muscle tissue again. Bruises will heal the fastest out of all of this. They usually heal completely under a week, especially if you're using light therapy. We see rapid results with bruises. Otherwise, you're looking at over a week, sometimes as long as 2 weeks to properly resolve a deeper contusion or bruise. DOMS, if you put light therapy on, and you can use light therapy, twice a day, even stretch it out to 3 times a day if you start early in the morning and later in the afternoon and maybe in the evening for DOMS, you should be good to go within 24 hours or so. But again, depends on how much you overdid it. So just again, don't return to the sport without properly ensuring that you have normal range of motion that's pain-free. So as far as what protocol to use, really, it's just a matter of following the protocols that correlate to the injured area that you're treating. I think that kind of makes sense. So again, it's important that you only return to your sport when you have normal pain-free range of motion. I came across this paper published last year, and they were looking at a meta-analysis is when you have a whole bunch of clinical trials, and then they pool them all together and look to see what the statistics show. And they were looking at what forms of exercise are most effective in preventing sports injuries. A lot of this information came from FIFA, which is the Federation of Football, the World Cup and everything. So they do tons. And if you play soccer, I do not, but if you play soccer, you know that injuries are really common, especially muscle strains, hamstring, pulled muscles, that kind of scenario. But injuries to tendons and ligaments are also really common. So they looked at all these different papers, and what they found was that what prevented injuries the most was so let's start with training. Neuromuscular training and eccentric training. That has been shown to have the greatest amount of benefit to reduce the risk of injury. And also they suggest during warm-up that you do neuromuscular warm-up. I'm going to tell you what that is or show you what that is shortly, as well as dynamic warm-up. You can imagine what dynamic warm-up might be, as opposed to static stretching. Static stretching, forget about it. Don't bother, waste your time with it. Do these types of exercises that are more dynamic, involve more movement. This is what will help you when you go into your sport. Strength training, by the way, doesn't seem to prevent sports injuries. So if you think you're going out there lifting all these weights to prevent sports injuries, research doesn't show that that's the case. Neuromuscular training focuses on performing exercises that train the nerves and the muscles to react and communicate. So you can imagine, let's say, let's say you're a tennis player. There's certain movements, certain things that you do in tennis. It's a quick, or pickleball, I suppose. Gosh, I don't know. I'm a tennis player and a squash player, and I'm like, I don't know about pickleball, but I just saw there's a competition between some of the retired pro tennis players like Nadal and some other guys playing pickleball. So maybe I'll take it up. Anyway, neuromuscular training programs are designed to both increase the strength of the joint and increase the individual's awareness of proper balance and technique. So it's basically setting your body up to remember and train for those specific movements that you're doing in that sport. That's what's going to possibly prevent injuries. Eccentric or negative training is a common strength training technique, involves manipulating the muscle lengthening portion of an exercise by slowing down the movement. So, you do your biceps curl, and then you slowly let it down. That's eccentric, as opposed to you do your curl and then you drop it down, right? So it's the eccentric, and I'll give you examples of eccentric exercises. Here are examples of neuromuscular training. And by the way, you go online, you can search all this stuff up for good programs. I'm not an expert in this at all by any stretch of the imagination, but you can find a lot of great information, obviously, on YouTube and the internet. So things like one-legged flexion, toe stands, one-legged stance. There was some research that came out that showed if you can hold a one-legged stance for, I think it was 30 seconds or a minute, the risk of dying within the next year is lower or something. I don't know if you guys heard about that. I thought that was quite interesting. Don't try that or whatever. I'm sure, I don't know how good a research that was, but it's interesting. Runner's pose, cross-legged sway, toe walk. These are all examples where you can imagine there's balance and strength that are occurring at the same time. And that's an example of neuromuscular training, and you can do neuromuscular warm-ups as well. Eccentric training, here are all the different examples, where you go up on a stair and then slowly let your calf down. These, you can see sometimes you need assistance, sometimes you don't. But essentially it's under load, lengthening the muscle involved. And I suggest if you're going to start to do these things, I would see a trainer or someone that, athletic trainer or someone that really knows their stuff to give you good advice and guidance, and then you can start to do them on your own, or just do them really carefully, but make sure you're doing them correctly with good form. Dynamic warm-up, this is from that paper, and this is what the FIFA players they suggest they do. There's 10 different exercises emphasizing stability, dynamic stabilization, eccentric thigh muscle training, proprioceptive training, plyometrics, and straight leg alignment. And these are just some examples. I know I'm getting overtime right now. Everything from single leg stance to figures of 8 inline leg stands, zigzag shuffling. And if you ever watch a warm up for an NBA game, you'll see players do these things. That's neuromuscular warm up. They're training their body, quick, fast strength movements, getting ready for those things that are going to happen in the game. So these are designed to be completed at least twice a week and at the start of each training session. So you do this as a training, and then you also do this before your event or your specific thing that you're going to do. All right, thanks for listening in. I'll get to the questions in a sec. So in 2 weeks, I have a similar webinar, but a lot more in depth, more specific to using the BIOFLEX Professional equipment, and I'll have a little bit more information on both acute and chronic sports injuries, although it's more acute, but I'll mention some of the other stuff as well too. So just be more in depth. We were out in Vancouver a couple of weekends ago. It was really fun, had a great time. We had an audience of well over 40 people for Let Up Your Practice. Really great information. I think everyone thoroughly enjoyed themselves. We have one coming up in Ottawa. If you happen to be in the area, you want to go for a drive to the nation's capital and complain about something, you can do that too. That's on April the 22nd, Brook Street Hotel. I think that's in the suburb of Ottawa, Canada, if I'm not mistaken. I also have an online one coming up on April the 15th for 2 hours on a Saturday. All right, let's get to those questions. So I'm using P180 for knee osteoarthritis. Check a video for knee pain. Should I feel more inflamed after the treatment? Can I use ice after the treatment? So generally speaking, when you're using the equipment, you may or may not feel anything right afterwards. It does promote circulation. It does promote the inflammatory pathway. Some people perceive this as increased or temporary exasperation of their symptoms. And that's actually probably a good sign. It's in the minority of people, but if that happens, you can throw ice on it, that kind of scenario, but it tends to reduce over time as you start to treat. Now, the question was from Claudia. What about, from iliotibial band when running? Yeah, so ITB, that's more of a repetitive chronic thing. So when you're treating ITB, it's critical first to understand the mechanics, get all that sorted out, because without that, it's going to keep occurring. But certainly treat the ITB band by placing the array parallel to the ITB band. It starts from the side of the hip and works its way down the thigh. So you have to do several placements for that, but it should be effective for that as well. Where does heat come in? Heat doesn't come in for acute injuries. I don't want you to use any heat. So if that's what the question was about, if you're treating an acute sports injury, don't use heat. There's inflammation going on. If you're treating chronic issues, then heat can help promote circulation. Otherwise, I'm not a big fan of heat because it's just an analgesic, and it doesn't really promote tissue health, although it can help with chronic symptoms like from arthritis, that kind of thing, when it's not in the acute stage. What about treatment from a recurring bulging disc in the lumbar spine? Richard, good question. I actually have a webinar on lower back issues. You might want to watch that in length. And again, it can be helpful for that. But when you're dealing with a bulging disc that's not healing, then that typically means that usually discs heal, but they may not, depending on the age, depending on other factors as well. But if you're getting symptoms because of that bulging disc, then using light therapy should be helpful in managing some of those symptoms. But I also prefer to use a laser as well for bulging discs. I think that's it for questions. I'm going to quickly open the chat box because sometimes people ask questions in there. No questions. Excellent. All right. Thanks for joining me today. Hope you had a great time, learned a little bit, and I will see you next time. Bye now.